Hi, my name is Dr. Ngosa Mumba. I'm from Zambia. I'm a consultant physician in internal medicine, and I work at the foremost referral hospital in my country, the University Teaching Hospital in Lusaka, Zambia. I'm one of the very, very thankful recipients of a Merck Foundation scholarship, which allowed me to take up a postgraduate diploma in cardiology at the University of Buckingham in the UK. I completed my course in September of 2024, and I'm still working at my public hospital in Lusaka. So, the online diploma with the University of Buckingham is a very wonderful cardiology training program. The content of the course is very, very detailed and very comprehensive. It gives me the confidence to be able to look after my patients, not only from treatment, but also from preventive cares and right through to palliative cares. I also had the privilege of studying how cardiology interacts with other specialties like pregnancy, cardio-oncology. So it's an extremely detailed course content. Also, the course allowed me to interact with top-of-the-notch faculty. I had opportunity to interact with faculty who are at the top of their various fields of teaching across different subspecialties in cardiology, preventive cardiology, endovascular therapies, and the like. The mode of teaching is online, and I must admit here that I initially had a little bit of skepticism about an online course because this was my second online course. But when we got into the nitty-gritty of it, all my anxieties were put to rest, and I found that the course content and the online teaching were very, very satisfying overall. So following my successful training in the course, and I should say to some extent, even whilst I was still training, I was fortunate enough to be given the headship of the cardiology unit at my hospital. And in addition to that, I was promoted to be the Adult Technical Working Group chairperson for my National Ministry of Health in Zambia. And this has allowed me to introduce several specialist clinics at my hospital, for example, an anticoagulation clinic. As you know, we have a lot of atrial fibrillation burden because of rheumatic heart disease in Africa, and in my country, it's no exception. We've also introduced an early heart failure review clinic, which has been taken up with very much eagerness by our heart failure patients at my local hospital. With respect to cardiovascular imaging, I've been able to train a pool of healthcare practitioners, not just doctors, but nurses, cardiac technologists, clinical officers, radiologists. And so we now have a pretty good threshold, a critical mass of local Zambians with this particular skill in country who are offering the service 24/7 in my country. With respect to some personal success stories, previously we didn't have enough MDT between cardiology and various specialties, and now I've been talking to my colleagues across specializations to be able to bring the best practice possible as recommended by international guidelines to our patients. For example, we've had patients who are receiving chemotherapy, and as you know, one of the organs that is inadvertently affected by cancer therapy is the heart, sometimes during treatment and sometimes long after treatment. With the skills that I attained from the course, I'm now able to coordinate care for these patients with my oncology colleagues. So you might be wondering, how has the training affected my career? Well, it's all been positive so far. I'm glad to report that because of the training I received, I've had numerous offers to help in teaching at several medical universities, where I've taken up lectureship in cardiology. I've also had the pleasure of having a number of successful patient stories where before we would have to refer patients either to higher hospitals or outside the country, but now able to manage these patients within my facility. So this has been a great plus for me personally in my career, but also a great cost-effective plus for our patients. if you should have the opportunity to take the course, I would strongly recommend you take up that Merck Foundation course. As you know, the PG course that I did was part of the Merck Foundation nationwide Blue Points program in hypertension and diabetes. And I would strongly recommend that you take up that scholarship and complete that course. It is simply practice changing, and it will benefit the lives of your patients immensely. I'd also like to take this opportunity to thank the Merck Foundation as a team, as a whole. The work that you're doing is really, really wonderful. And I hope that your legacy, Dr. Senator Khalej, will continue because the work you're doing in Africa is really life-changing. And I think it will have benefits for generations to come. Thank you, Merck.